Hello and welcome to this edition's EuroPCR 2019. My name is Nicolo Piazza. I'm an interventional cardiologist from Montreal at the McGill University Health Center. And today I'm joined by my good friend Ran Kornowski, also an interventional cardiologist and chief of the lab at Rabin Medical Center. Welcome, Ran.
Hello, Nico. Pleasure to be here.
So today we're going to talk a little bit about Innovators Day. Can you maybe give us a little bit of background about what is the real goal of Innovators Day? Why do we create such a program?
Innovators Day is a very important program as part of the EuroPCR, and actually it's become a tradition. This is a key platform to convene experts from various fields, physicians, people from the industry, scientists from finance, regulatory agencies, in order to promote innovation, to discuss startups, ideas, hurdles, and to change a lot of things in terms of promote the next thing in cardiovascular medicine. So it's a very important and I think also a very fruitful event that is one of the highlights of EuroPCR.
So Ran, when we talk about innovation within the field of interventional cardiology, there's multiple branches. There's the coronaries, there's structural heart disease with aortic, mitral, and tricuspid. We have cardiovascular neurology. We have heart failure. Can you tell us a little bit about what we saw with respect to the coronaries this year?
I think coronary was very interesting. We saw several technologies that were aimed to enhance the efficacy of the drug-eluting balloon. There are many aspects, remaining issues concerning drug distribution, how to foster the efficacy of balloons. I think this was an important discussion and some presentations. We also have to deal with the problem of microvascular dysfunction and no reflow, and we had some interesting presentation on that field as well. We also were witnessing some interesting combination between how to manage patients on the coronary side on the one hand, and how to support the heart during the intervention. So assist devices combined with coronary intervention becomes almost an inseparable field that was also presented and discussed in the Innovation Day. I think, there is the perception that we have reached a plateau with coronary intervention, but I think there is still room for improvement.
Yeah. And can you tell us a little bit about some of the ancillary devices that we're looking into with respect to structural heart disease and transcatheter aortic valves?
Many presentations were discussed, and actually the field of mitral and tricuspid intervention is still proliferative. We are all looking for the Holy Grail, and probably it's not going to be a single Holy Grail. There are going to be several interventions, and there were some interesting concepts and idea, a new valve for the tricuspid, new procedures for the mitral, such as the cerclage, which might be a very provocative concept, which could serve as a platform not only for the mitral, maybe for some additional interventions. I think that we are witnessing a lot of efforts geared towards improving mitral care and tricuspid care, and I think that it's going to work, and hopefully in a few years from now, once we're going to discuss, we're going to see some winners and concept that would become hopefully standard of care. Look how long it took for the mitral clip. Okay, so we have to be patient, we have to be resilient, but the ideas are very original. Some of them were really provocative and certainly exciting.
Yeah, it was interesting to hear that there's currently over 30 devices in the transcatheter mitral valve repair field, and over 30 devices being developed in the transcatheter mitral valve replacement field. So lots of innovation in this field. There was also some mention about cardiovascular and neurology. with respect to stroke therapy, and perhaps even maybe altering the sympathetic, parasympathetic nervous system to improve cardiovascular outcomes. So what were some of those ideas?
Yeah, I was fascinated by the concept of selective brain cooling in order to treat stroke. I think it's a very, very interesting concept that should be taken to, I think, to the next level in terms of clinical trials. Stroke intervention is certainly something that is an unmet need. We know that a significant proportion of stroke patients are not being treated using percutaneous devices or acute interventions, so there is a lot to do in this respect. And I think the integration of cardiology with neurology is really fascinating. I mean, look how many things we do in terms of pharmaceuticals and device-based intervention that we do in order to prevent stroke. And I think it's going to increase over time for sure.
Mm-hmm. So, Ran, I think what we've noticed during Innovators Day, that the field is in fact very, very healthy, that there are a number of devices being developed across the spectrum of coronary, structural, and cardiovascular neurology and heart failure. And I think one of the most important words that you mentioned is resilience. And I think this is a key word for innovators. Because only with resilience, I believe, will improve the outcomes of our patients.
Certainly. You know, I come from Israel, and in Israel you live and learn how to become resilient. But it is an important concept for innovation because there are many hurdles. We tend to mention the glories and the promises, but we have to remember that in innovation, you have to be ready to fail. If you are not ready to fail, it's very difficult to deal with innovation. So failure is part of the innovation. Dealing with hurdles is part of the innovation. And I think this is a key message that all those that want to do innovation should keep in mind and remember it on a daily basis.
Yeah, I guess, Ran, we can look forward to next year Innovators Day and look at some of the follow-ups of some of these devices that were presented this year. And it would be interesting to see what type of progress they have made as well.
Sure, with great excitement and anticipation.
Yes, thank you.
Thank you.